I think the worst part about back pain is that it seems unpredictable, like one wrong move and you're out for days or weeks. Stretching may bring temporary relief, but you need strength for freedom. When you've tried everything and nothing seems to work, there's often a hidden postural habit that keeps your low back feeling fragile. For years, body workers, chiropractors, and doctors have sent clients to me because if you don't clear up these hidden habits, you get stuck in this cycle of pain. But once you see them, you can't unsee them, and I will teach you exactly how to get out of them. Let's dive in. I've had my fair share of lower back pain. There was a season where my SI would go out consistently, and it was so frustrating because I actually didn't know what was going to set it off. I would find myself getting stuck, like my ribs forward, or my posture is weird, or my low back was kind of achy and tense, but I didn't know how to get out of it. Even worse is I'd often do things and overcorrect for it. I would start tucking in order to feel more stable in my lower back, or gripping in other areas, and that only perpetuated the problem. Then I'd start stretching and trying to fix it, and it was like my lower back would protect and guard even more. The metaphor I think of is like a scared cat underneath the bed. The last thing you want to do is reach underneath the bed and try to drag that cat out. But I was doing that to my lower back, my own body, all the time. It would start getting tight or achy or cranky, and then I would start grabbing and pulling and twisting and stretching and trying to fix it. And it was only making things worse because you cannot stretch your way out of a stability problem. But I didn't understand that. I didn't know I was lacking strength, and I needed to build strength in order to stabilize my lower back. It sounds kind of silly, but it's true, and it might be true for you too. During this season of lower back pain, I was told that core strength would help my lower back. But every time I did core strength, I just felt it in my hip flexors. It was like more gripping and grabbing and then achy, cranky. I was also told to strengthen my outer hips. So I would do things like clamshells and bird dog, but those are boring. And like the core work, I was often just tightening other things. I wasn't actually getting the stability I needed. My breakthrough came with breathing. I was working with one of my teachers, and we were trying to figure out why my SI joint kept going out, and he had me doing all the things when finally he said, stop right there, breathe. And I did, and he had me do a few things, really working breathing into my back body more specifically. And then he said, when you're breathing properly, your alignment is fine. And I could feel it. I could sense that it was true too. But I soon discovered I couldn't always breathe that way. I was still missing something. What I eventually discovered is that I lacked the strength to keep the postural alignment of rib cage over pelvis so that my breathing generated the intra-abdominal pressure necessary for a strong, steady core. Now that sounds complicated. Here's the short version. I lacked strength. I lacked strength and had poor postural habits that kept me stuck and kept me in a cycle of pain. Part of what was tricky is that I had one kind of poor postural habit that I was in all the time that I thought was good. And then I would correct it as my lower back started to get achy and go into another poor postural pattern. And that ended up creating a lot of tightness and restriction and gripping and guarding in different parts of the body. So I was never getting the true core and inner support I needed for my low back to feel stable. Sounding familiar? Over the years, I've seen hundreds of students and clients cycle through these same postural patterns. I'm going to show them to you. Look for which one is most common to you, like your default setting, but also what do you go to? What do you do when you're trying to protect your lower back, when it's feeling fragile or achy or like it might go out? Because chances are you bounce to another postural habit that is just as problematic. Important to note, these are survival strategies. You were told to do these things, and it's not that they're inherently bad. You're just missing the key ingredient that would give your low back stability. Hidden habit number 1 is the good posture trap. This is very common in yoga asana practitioners, people who like to do things right, do things well, have good posture, and it's the habit of pushing your chest forward and up and your butt swinging back. When you're stuck in this habit, your SI joint feels unstable or achy. We'll talk about how to get out of it in a moment. Posture habit number 2 is the safety tuck. Here, you scoop your tailbone under, which gives you the illusion of strength and stability for your lower back. People who tuck under too much often feel like their lower back is achy, especially the area in between the lower ribs and the rim of the pelvis. Often, if your default is the good posture trap, when your SI joint starts to feel achy, you then overly tuck under and try to protect. The inverse is true if you tend to overly tuck under as your default setting. Then you notice that you're rounded, you're kind of slumped and hunched. You see a picture of yourself and you're like, ooh, that's bad. And then you push your chest forward and up and stick your butt back. So now you're in the other habit. It's like you've just switched sides. The last postural pattern is panicked gripping. And this might be a byproduct of ping-ponging between the other two. Some people just tend to live here, and it's when you're using superficial muscles instead of your deep core. So maybe it's your neck and your jaw, and then you have migraines or chronic jaw pain, or maybe you tend to over-recruit psoas, and then you feel this pulling on your lower back, or there's tension in your groins, or you over-recruit some of the external rotators. So you've got that achy, pinchy, grabby stuff at the upper rim of the pelvis or lower back. Again, notice which one tends to be your default setting and then how you attempt to correct. And the good news is there is one fix for all 3 of these postural habits. To get out of pain for good, you need 3 things. So to get out of whatever postural pattern you're in, true core is our first 2 of the 3 things. Rib cage and pelvis stacked, breathing driven by your diaphragm. Number 3 is the strength to maintain the alignment of rib cage over pelvis. This was what I was missing for years. There's a video with 5 exercises to build the strength you need to keep rib cage and pelvis stacked so your breathing is generating all the stability you need for your lower back. Do that practice next. Now that you know which postural pattern tends to be your default setting, let's identify what muscles you need to strengthen first to get out of that habit for good. If ribs forward, butt back, that good posture trap tends to be your default setting and where you get stuck, where you find yourself most often, the most important thing for you to do is draw your ribs in and down and get your pelvis neutral. And the muscles you need to strengthen for that are serratus anterior, these muscles on the side ribs that help you pull the ribs in and back, the upper abdominals, especially transverse abdominis, and the hamstrings. The hamstrings are like anchors on the backs of your pelvis. They'll pull the sitting bones down and help you get the neutral pelvis so rib cage and pelvis are stacked. If your default setting is overly tucked under, you've probably done that because it helps you feel safer in your lower back. But now it's preventing you from building the strength you need for long-term freedom and stability. With the safety tuck, you have to allow your pelvis to rock back to get more neutral, natural curve at the very top of the sacrum and the bottom of the lower back. When you have the pelvis rocked back, you can start to access the pelvic floor, which will move in rhythm and in relationship with the respiratory diaphragm, and then the low belly will lift up and in. So you'll get a hug for your lower back that's coming from your deep core, not just excessively tucking under. If allowing your pelvis to rock back feels a little scary, remember this. There are these amazing muscles that run up your spine like shoelaces. They're called the multifidi. And anytime the pelvic floor is engaged, the multifidi turn on too. They're too deep for you to feel. They're not innervated. So you have to trust it. But it does come on with the rhythm of your breathing and the movement of your pelvic floor. If you're excessively tucked under, you are blocking this magical mechanism from occurring. If you're the type that tends to grip and grab, with psoas, with your outer hip muscles, with your neck, with your shoulders. The key is breathing and trust that it's enough. And that is one of the most difficult things that comes up with clients, especially if they've had a long-standing habit of gripping and grabbing and protecting their lower back, is it feels like they're just not doing enough when they're breathing. Often we have to revisit their old postural patterns to see that that is actually causing the strain and the stress and the cycle of pain. And then we do things with the breathing and they realize they feel spacious, they feel supported, they feel free. It's just not the sensation they're used to. And again, this story of not enough. With all three of these posture patterns, we are replacing habits of gripping and grabbing and pushing and thrusting and holding and guarding and protecting with deep support that comes from your alignment and your breathing. But it will take strengthening certain muscles to get your body to hold that alignment all the time. If you find yourself stuck in one of your old postural patterns, your habit of pushing the ribs forward, the butt is stuck back, or you notice you're really tucking under and starting to get grippy and grabby in your hip flexors, or achy in your lower back, you're starting to tense up in your shoulders and your neck. Here are 3 resets that will give you the space you need. It'll get your body to calm down so you can do the strengthening that brings the long-term support. The number 1 reset and also low back emergency care is legs at 90. This allows your pelvis and your lower back to adjust itself. Use this liberally, especially if you feel like your low back is tweaky or you're stuck in one of those habits. Number 2 is rolling the outer hips. It is absolutely astounding how much tension most of us hold here. I recommend using an alpha ball by Yoga Tune-Up. I think lacrosse balls are too firm, too small. This has just enough give and it's firm enough to give you results. Number 3, core press. Here, you teach your body to recognize when the rib cage and pelvis are stacked, and then you develop your breathing to generate that rhythm of relationship between respiratory diaphragm and pelvic floor. You'll also want to activate the hamstrings just a little bit, like you're curling your sitting bones to the backs of your knees, so you start to strengthen that hamstring attachment area that anchors your pelvis. Remember that stretching will bring relief, but strength brings freedom. Use these resets to give yourself the space you need so you can do the strengthening. And if you want my top 5 exercises for strengthening, go to the Strengthen Your Lower Back practice. Now, it's one thing for me to tell you all of this. It's a totally different thing for you to see it in your own body, to diagnose the patterns and the habits that you have, and then to use what you've learned to make the necessary adjustments. So I recommend that you film yourself doing 3 things. Number 1, half sun salutes. In half sun salutes, watch your postural pattern when you come up to standing, and don't try to get it right on the video. Do what you normally do so you have an honest assessment of what's going on in your body. Number 2, cat and cow. Watch for the rhythm of your spine. Do things move evenly? Is the rounding in cat consistent? Is the arch in cow consistent? Or do you have areas that aren't moving as much, or not moving at all, or moving too much? Number 3 is Utkatasana. Here you'll be able to see if you excessively tuck under or if you thrust your ribs forward. It's an excellent assessment of which postural habit you tend to, especially when standing, walking, bending over to pick things up. And remember that Utkatasana can be done like a gym squat, and I recommend that you do it that way because it's more functional. Then you're training your body to find the stacking of rib cage and pelvis. You're learning to generate intra-abdominal pressure with your breathing. It is a very therapeutic posture when it's done more like a squat done at the gym. Make filming yourself a game. It is an incredible self-diagnostic. If you want more help, if you can't quite see what's going on in your own body, send me your film. I will help you assess and give you recommendations. I can even recommend practices for you. My email is in the description below. Now that you know which habit you tend to get stuck in, you can work to rewrite that postural pattern to clear out the root cause of your low back pain. Then when you start to do core work, strength work, yoga asana, Pilates, you will have so much more power and stability in your own body. It will be amazing. And if you want a maintenance plan, the 5 exercises I use most often for myself and my clients, go to the Strengthen Your Lower Back practice. Thanks for being here. Thanks for watching. If you've enjoyed this, hit the thumbs up button. Subscribe if you want more of this type of conversation.